And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So ADHD and obesity, you think the two are related?
I think so. I mean, it's obviously a risk factor for obesity. We're struggling as a community, as a country with obesity, so it's just not ADHD. But I think that population is certainly more at risk, as I mentioned, because of the impulsivity of making choices. Typically, they're also on medications, which sometimes can cause weight gain and cause them to want to eat things that are not good for them. But it's overall a global community problem here in America, but it seems to be a big risk factor based on my experience and as the study reports. So it's just not the folks with ADHD that need a lot of help. Everyone in general does as well.
All right, on to some of our viewers' medical questions. This viewer writes, there's a lump around where I had my C-section in '05. I've been having a lot of medical problems since then. I'm scared that this might be cancer or whatnot. Don't know what to do.
That's always a concern. Certainly just have to get the proper evaluation. Typically in this situation probably would be a CAT scan of the abdomen. Depending on what they see, they might want to do a biopsy and do some blood work. As I've mentioned before, that is really the only way to diagnose cancer is with a biopsy. So if she has some concerns, don't ignore it. Get to her physician for an evaluation.
Could it just be scar tissue, just built up?
Absolutely, but we hate to say that without examining the patient, talking with the patient. Certainly the patient is concerned about it, and we want to make them feel more comfortable about what it is or is not, and typically just requires an evaluation. We typically don't like to do things over the phone. I know a lot of patients call in and they have a lot of concerns and questions. I mean in the office, that is. We just have to see them, examine them, talk to them, maybe do some blood work, x-rays. Even the best physician, we need all that information to make a good decision.
Okay, another question. This person injured their SI joint. How long does it take to heal it?
As with any joint in the body, it just depends on the severity of the original illness and what type of medical problems you went into it with. If you had a lot of arthritis to begin with, probably it's going to take a lot longer for that to heal, depending on the types of medicines you're using. So it just depends on the patient. Anywhere from a week to maybe even 6 months. Sometimes physical therapy is needed and injections, sometimes surgery, but typically not.
Okay, another question. Why would someone need to go to an LTAC?
LTAC is starts with a long-term acute care facility. They have a couple here in town. Harbor LTAC is one. They have one in Mid-County. It's primarily for patients who need to be in the hospital for a prolonged period of time, such as heart failure, stroke, pneumonia, poor nutrition. As you know, hospitals, we can't keep them in the hospital very long, patients, so we have to transfer them to a facility such as an LTAC where they can stay about 3-6 weeks to it in order to get better from their illness.
Okay, another question. This person wants to know, is there a pediatric specialist in this area?
It just depends on what the illness is. As you know, a lot of times they tend to be in larger cities. It just depends on the need of the community. Here in Beaumont, probably not a huge need. A pediatric specialist like maybe a GI doctor or a neurologist might not have the volume here in Southeast Texas and may do a better job in a tertiary facility such as Houston, so that they might not be attracted to come down here, but it just kind of depends on the need, and probably that's why there are not a lot here.
Okay, another question. When I rub on my thighs, I feel knots. What do you think that might be?
Probably just adipose tissue, unfortunately. You know, we struggle with that all the time. Just have to push away from the table, get the exercise out. Maybe even some plastic surgery might help with that.
Okay, another question. What would be the reason for an entire fingernail to turn dark yellow?
It may have been injured at the nail bed. Sometimes medical problems can cause that. Sometimes medications. Certainly I would get to the physician for an evaluation, some blood work. So certainly that's an abnormal nail, and I would just get a basic evaluation for that.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person wants to know, what could cause the left side of the face to go numb other than a stroke?
Sometimes a condition called trigeminal neuralgia can sometimes cause numbness. It's a peripheral neuropathy of the face.
Stroke is neuropathy a lot.
Absolutely. Stroke is probably going to be at the top of the list in causing that, but that's another condition that can certainly contribute to that. Certainly get to your doctor, because it's hard to tell if it's stroke or trigeminal neuralgia, so a serious condition typically.
Okay. This woman lays at night on her right side, but her left chest begins to hurt. Why is that?
Well, it could just be osteoarthritis. I mean, depending on the position, when we put stress and strain on our musculoskeletal system, and just depending on the type or degree of degeneration, could cause discomfort. We would probably just tell the person to sleep differently, maybe take some anti-inflammatory medications at night.
Okay, 6-year-old girl is 67 pounds. She spits a lot and she has stomach problems. What could be the cause?
Probably some sort of gastrointestinal illness. A lot of times it will require maybe an endoscopic evaluation or a study where she swallows liquid to look at her esophagus and her throat. Could be a neurological issue that's disturbing her ability to swallow. Certainly it's abnormal, shouldn't be ignored, and certainly get to your physician to make sure what that is or is not.
Okay, a 52-year-old woman has a knee injury. What can be done other than steroid shots?
Well, it just kind of depends on the knee injury. Certainly there's arthroscopic surgery. The orthopedists are very good at that. Typically would require an MRI in some cases. So not all knee injuries are surgical. A lot of them are non-surgical, can be treated with physical therapy, anti-inflammatory medications, and drainage of that knee. So it just kind of depends on the injury.
Okay, another question. Let's see, my left leg and foot stay swollen. What could be some of the problems?
A lot of times that's what's common in America is venous insufficiency, brought on a lot of times by sedentary lifestyle, maybe being a little bit overweight, body mass index over 30, heart failure, kidney failure, medications, including Norvasc is a common one. We see this actually often a lot in the office. A lot of times we start off with compression stockings. There are some surgical procedures that can be tried for the swelling, but certainly some blood work sometimes is necessary to look for those other illnesses.
Is it good to raise your feet to elevate them as opposed to always having them down when you're in a seated position?
Absolutely, that's a good thought, and we always consider that when we're counseling patients. It can sometimes get a little uncomfortable for patients as well as the compression stockings, but that's certainly something that we can try as well.
Okay, another question. I'm in the process of a hearings referral to a specialist for gallstones. They're blocking my bile ducts. My liver enzymes are at 367 and 165. I was told that this was caused by gallbladder problems. Is this true? And is gallbladder surgery the only way to fix it?
Typically when gallbladder is causing that degree of problem, that's more of an immediate issue. Typically we like to perform surgery within a day or two.
Wow.
There's also a procedure called an ERCP that is performed to unblock those gallstones because the liver does not like to be blocked like that. Absolutely, the gallstones can cause that. We see it every single day, but I'm a little surprised if the patient is at home. I would certainly probably get to the emergency department because that can cause some really serious problems.
Well, they could be posting from their phone from their hospital bed too. So.
I hope so.
This person says, I have a burning sensation on my right leg. What could be wrong?
Oh, a lot of times, again, we talk about neuropathy. There are some superficial neuropathies. Diabetics get them a lot, as well as overweight patients get them a lot. We sometimes use a topical pain medicine called Lidoderm that works really well, but we all have our old standby, such as Neurontin and Lyrica, that work well as well.
All right, Dr. Levine, as always, we appreciate you taking the
ma'am.
time to stop by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, or email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.